Hey gentlemen, my name is Dr. Jame. How's your health these days? Let me ask you something direct. Why can so many women enjoy oral pleasure freely, while men freeze in fear of HIV, even when the scenario has almost no real risk? In this video, I'll share 3 truths every man should know and reveal a solution that helps us stay confident and in control every time. In 2025, CDC data show over 61% of men under 40 still overestimate oral HIV risk. Here in the US, we talk openly about boundaries and safety, yet this anxiety persists. As a doctor, I understand that fear, it's not ignorance, it's protectiveness taken too far. If you've ever had this thought quietly in your mind but never spoke it aloud, this section is for you. If the topic resonates, subscribe and type OK, so I know you value straight talk from a doctor who cares. Stay with me until the end, because I will share a surprising truth, a clear guideline to tell imagined danger from actual risk that could completely change how you see intimacy and health. 1 month ago, a shy young man came to see me. I smiled and told him, "Be candid, I'm a man too, just someone who walked this road earlier." He exhaled, lowered his shoulders, and asked the question that hesitate to say out loud. "Doctor, why do I like this but still feel nervous and embarrassed?" I answered carefully, because language matters when fear meets desire. What most men are searching for is not a performance. It is presence. It is the chance to care for someone, to listen to their body, and to make them feel safe and seen. That is why I teach a different frame. Devotion, not lust. Devotion is steady attention without pressure. It slows your pace, softens your mindset, and keeps your focus on comfort, consent, and calm breathing, not on doing something impressive or dramatic. When devotion leads, you naturally look for small signals. A relaxed jaw, easier breaths, feedback like a nod, or a hand guiding you. Those signs tell you to continue. A stiff posture, held breath, or flinching tells you to pause, adjust, or stop. This caring mindset changes everything. Anxiety eases because you are not proving anything. You are offering something. Confidence rises because your goal is connection, not choreography. Intimacy deepens because both people feel respected, in control, and safe. As a physician, I remind my patients that comfort and consent are clinical priorities. They are not extras. They protect health, lower inflammation, and prevent miscommunication that can lead to regret. Let me ask you, have you felt this tension? Wanting to give but fearing judgment or making a mistake? Or have you seen a partner wrestle with the same hesitation, unsure how to start the conversation? It's not just about desire, it's about giving, and that changes everything. Friend, let me ask you something simple. In love, what makes 2 people feel free, brave, and comfortable enough to be real with each other? For me, it is one word: emotions. And as a physician, I can tell you emotions guide safety as much as technique. One of my patients said, "Doctor, I keep worrying I will do it wrong. I do not want to be judged." That fear is not rejection, it is respect. It is the wish to protect a partner from discomfort, to avoid crossing a boundary, to do the right thing at the right pace. When we understand that hesitation, everything softens. Emotional attunement builds trust. Trust increases comfort in the body. Softer muscles, easier breathing, less guarding, more warmth. The brain shifts from alarm to calm, and the body follows. Here is the practical part I teach in clinic. Ask short, kind questions before and during intimacy. What feels good today? Anything to avoid? If something feels off, say pause. Then watch for the emotional signals. A smile that reaches the eyes, shoulders lowering, a laugh, a deeper exhale. Those signs say, continue. If you see uncertainty, slow down. If you sense pulling away, stop and check in. You will not lose the moment by asking. You will create the moment by asking. This is why I tell men, intimacy is not a performance. It is presence, care, and consent in motion. The more you honor feelings, the safer the body becomes. For him, it's not performance. It's devotion in its purest form. If you are still here, type "still watching" in the comments so I know you are with me. Next, give me 60 seconds and I will show you the path forward. You already understand yourself. Now you need to understand her. We will lower self-consciousness so she feels safe to speak. Many women carry quiet worries about age, body image, dryness, or pain. Those worries often turn into fear of judgment. When fear shows up, muscles guard, breathing shortens, and the mind second-guesses every signal. Here is the doctor's approach. Lead with reassurance, not pressure. Say, "We set the pace together, and we can pause any time." Invite preferences up front. What feels good today, and what should I avoid? Offer options, not commands. Use neutral, respectful words, and avoid scorekeeping language like good or bad. If menopause-related dryness is part of the picture, normalize it. Explain that hormones influence tissue moisture and sensitivity. Recommend gentle hydration, adequate arousal time, and physician-approved lubricants. If pain appears, stop, check location and quality, and pivot to what feels comfortable. From the male perspective, connection matters more than perfection. Your partner is not an exam you must pass. She is a person you can protect and honor. When you slow down, ask, and listen, confidence rises on both sides. Let me ask you, which concern lands closest for you or your partner? Age, body image, dryness, pain, or fear of judgment? If this segment helped you exhale, type "I choose confidence" in the comments and tell me why. If you try these steps and notice improvement, return here and leave a note. Your updates guide my topics and help other viewers grow with you. Here's the part no one tells you: what he actually sees when he looks at you. Give me 1 minute, and I'll show you 4 science-backed reasons this kind of intimacy captivates people across ages. In clinic, almost everyone asks about it, and I appreciate your directness. No need to speak in circles with your own doctor. First, circulation. Gentle arousal increases blood flow to pelvic and surrounding tissues, which supports oxygen delivery, nutrient exchange, and healthier tissue response. Better perfusion often means warmer muscles, less guarding, and greater overall comfort. Second, chemistry. Your body releases oxytocin and endorphins, hormones linked to bonding, pain modulation, and calm focus. When those signals rise, the stress system turns down, and the mind experiences more safety and presence. Third, tissue health and moisture. With consent and adequate warm-up, the mucosa and adjacent tissues hydrate and respond more fully. That improved lubrication and elasticity can reduce friction, micro tears, and post-encounter irritation. Fourth, stress relief. Rhythmic breathing, close contact, and mindful pacing activate the parasympathetic nervous system, the body's brake pedal. That state lowers cortisol, steadies heart rate, and helps both partners feel grounded instead of anxious. Here is the frame I recommend as a physician. Think of this as a form of natural therapy, not a performance. Natural therapy means 2 non-negotiables: consent and boundaries. Consent is enthusiastic, specific, and revisitable. Boundaries are clear, respectful, and easy to pause. When those 2 are honored, benefits compound. Comfort improves, recovery is smoother, and communication stays open. If any discomfort, pain, or bleeding appears, stop, reassess, and pivot to what truly feels good and safe. And remember, technique matters less than presence, pacing, and listening to real-time feedback from partner. It's passion, yes, but it's also medicine for your body and your soul. Listen closely, gentlemen. I want you to be absolutely clear about this. Shame has never protected anyone's health. It only silences questions and delays real care. Last week in clinic, a 20-something sat across from me. Eyes down, voice barely above a whisper. "Doctor, I was taught this is dirty. Am I a bad person for even wanting it?" I said, "No, you are a thoughtful person trying to love well." Then we walked through 4 pillars that replace shame with ethics. First, consent. Consent is enthusiastic, specific, and revisitable. It is the green light you confirm, not assume. It can change mid-moment, and you honor that immediately. Second, respect. Respect means language that does not belittle, pressure, or keep score. It treats your partner as a whole human, not a task. Third, hygiene. Clean body, healthy mouth, and attention to sores or bleeding reduce irritation and confusion. When in doubt, pause and pick the safer route. Fourth, boundaries. Agree on what is in or out today. Boundaries are not walls. They are bridges that let 2 people meet in the middle without fear. When he heard this, his shoulders lowered and his breathing slowed. Confidence returned, not because I handed him tricks, but because we replaced taboo with a simple, honorable code. Here is your takeaway. Speak the plan out loud, keep it clean, check in, adjust, and remember that dignity is the real foundation of intimacy. Those old scripts, dirty, taboo, sinful, were lessons, not destiny. You can unlearn them with compassion and replace them with clarity, care, and responsibility. That is adult masculinity. The words that once made you feel ashamed may be the very keys to your freedom. Gentlemen, strategy matters. When you enter intimacy without preparation, confidence drops and overthinking rushes in. This segment is your playbook, designed to give you calm, control, and a cleaner mind before anything begins. Fresh breath matters. Hydrate, avoid strong onions or alcohol beforehand, and skip smoking right before intimate time. Trim facial hair if scratchy. Start with a simple hygiene ritual. Shower, trim, brush, and choose a light fragrance or none at all. Keep nails neat. Prepare a fresh towel, tissues, or wipes nearby so you are not scrambling mid-moment. Set the space. Soften the lights, reduce noise, and make sure you have privacy. Place water on the nightstand. A quiet, uncluttered room lowers adrenaline and invites slower breathing and easier conversation. Do the 30-second pre-talk. Ask 3 questions. What feels good today? What should I avoid? If something feels off, can we say pause and adjust? These lines are respectful, brief, and incredibly effective at preventing misunderstandings. Keep supplies within reach. Lubricant approved for oral or skin contact, lip balm if needed, and a small trash bag or bin. If there are mouth sores, bleeding gums, or illness, reschedule. Health comes first. Run your mental checklist. Clean, prepared, private, hydrated, and aligned on boundaries. When your mind knows the plan, your body follows. Muscles relax, attention sharpens, and presence replaces pressure. If this playbook helps, tap a like so I know to create more practical doctor guides for you and your partner. Preparation isn't about perfection, it's about peace. Here is the golden rule, gentlemen. I can explain it in 60 seconds, but living it is a process. Presence beats technique. Master this, and your partner will remember how safe, seen, and centered she felt with you long after the moment ends. Choose a quiet space so attention can settle. Dim the lights, silence notifications, and remove distractions. Slow the tempo on purpose. Breathe through the nose, out through the mouth, and match her rhythm. Watch her shoulders and hips for yes or not yet. Ask short, kind questions. Like this? Slower? Pause? Use yes or no prompts, then wait. Do not stack questions. Confirm, adjust, and return to steady, unhurried focus. Let comfort lead and curiosity follow. If detention rises, step back, reset breath, and begin again. Soften your hands, unclench the jaw, and release your chest. This reduces pressure in your own body so you can sense microsignals better. A deeper exhale, a head tilt, or a hand guiding you. Those are green lights. A held breath or flinch is a red one. Remember why this works. Presence tells the brain that the scene is safe, which lowers adrenaline and pain signals. Safety expands pleasure. Technique without presence makes people feel managed. Presence turns care into connection. When presence replaces pressure, everything changes. If you found this useful, leave a like so I know to build more practical, respectful guides. Practice in low-stakes moments. Breathing together, holding eye contact, naming sensations gently. Also, try it daily. Presence is not flashy, but it is unforgettable because it honors timing, consent, and the living person right in front of you. That is how a moment becomes a memory. Here is a story from Clinic, and it has stayed with me. Lisa and Peter, married for 25 years, told me their happiest season began when they changed one habit. They started speaking first before anything physical. They called it their 3-pillar promise. Pillar 1 is speak first. They sit down, breathe, and ask 3 gentle questions. What feels good for you today? Anything you want me to avoid? If something feels off, just say pause. We'll slow down. Their tone is light, curious, and kind, never transactional or pressured. Why does this work? The brain relaxes when expectations are clear. Anxiety fades and the body follows. Lisa said her shoulders dropped the moment she heard Peter ask, not assume. Peter said he felt calmer because he finally knew what to do and what not to do. Pillar 2 is stay safe. They treat health like teamwork. They keep hygiene high, skip intimacy during mouth sores or illness, and keep appropriate lubricants within reach. They check meds and interactions with their clinician when needed, and they screen for STIs on a sensible schedule without drama or blame. Safety does not kill desire, it frees it. When both people feel protected, attention returns to warmth, breath, and presence instead of scanning for danger. That is how long marriages rediscover play. Pillar 3 is set boundaries. They choose what is in or out for tonight, not forever. A boundary is not rejection. It is a bridge that tells your partner where to meet you safely. Boundaries make trust predictable, and predictable trust makes desire less fragile. Lisa and Peter also changed what happens after. They drink water, clean up, and cuddle for a few minutes. They call it aftercare, and it has done more for their connection than any new technique. Small rituals build big security. One more point, especially for men. Porn is not a playbook. Real intimacy is responsive, improvisational, and alive. It rewards listening over performing. The goal is not to copy a scene, but to notice a person. And if something goes wrong, they circle back, apologize, and try again tomorrow, because progress is a practice, not a test. If you want more calm, confident conversations about love after 50, subscribe and share this video. Your engagement helps me keep making physician-level guides that are respectful, realistic, and useful in real life. The best years of passion might still be ahead. Here is what we learned, and then I will deliver the promise. Men often love this kind of intimacy because it is devotion, not performance. They want to care, listen, and build safety. Emotion amplifies comfort. Technique stays respectful, and shame loses its grip. Confidence returns when we slow down, speak first, and set clear boundaries. That is how couples choose intimacy again with calm, courage, and mutual care. Now the promised rule, the clarity that separates fear from facts. Illusion of risk, contact of intact skin with saliva, or dry residue on a dry surface, or outside contact that does not involve a mucous membrane and no blood present. Those scenes do not match how HIV transmits. Actual risk, blood or infectious fluids contacting a mucous membrane, mouth, eyes, genitals, or an open, bleeding wound. When that happens, we switch from anxiety to action. Doctor's 72-hour protocol. PEP. Flush or rinse immediately. Note the time and seek care promptly. We consider PEP within 72 hours if the exposure truly fits. Testing timeline. Early NAT when appropriate. Fourth-generation testing at 3 to 4 weeks, repeat at 6 weeks, and confirm at 3 months per guidance. Prevention habits. Condom plus lube to reduce micro-tears. Maintain oral health and skip intimacy with mouth sores or bleeding. Schedule regular STI screening. And clean up after with simple hygiene. If you take one idea with you, make it this. Safety is a skill, not a mood. Practice it, and fear shrinks while connection grows. Love deepens with age. Intimacy has no expiry date. You heard a promise in the hook. This is the fulfillment. A single rule to tell imagined danger from real risk, plus the action steps that protect you and your partner with clarity, consent, and calm. Every time. Reliably.